Did you know that some fruits, despite being healthy, can raise your blood pressure? Discover which ones and how you can adjust your diet to keep your heart strong and healthy. Diet plays a crucial role in maintaining cardiovascular health, and understanding how different foods impact blood pressure is essential for preventing and managing heart-related conditions. While many people are aware of the effects of salt consumption on blood pressure, the impact of certain fruits is less known. Fruits are generally seen as healthy components of a balanced diet, rich in vitamins, minerals, and fiber. However, some of them contain significant levels of natural substances that, depending on the amount consumed and individual sensitivity, can influence blood pressure in surprising ways. Therefore, it is important not only to include fruits in your diet, but also to understand which ones can have specific effects on blood pressure. This knowledge allows people to adjust their eating habits to better support their cardiovascular health. For example, fruits high in potassium are known to help control blood pressure, but the impact can vary depending on other individual health and dietary factors. Additionally, some fruits may contain modest amounts of sodium or other compounds that can raise blood pressure in sensitive individuals. Thus, an informed and personalized approach to fruit consumption can be a valuable component in managing cardiovascular health. Blood pressure is a measure of the force that blood exerts against the walls of the arteries as it is pumped by the heart to the rest of the body. It is a vital health indicator, usually expressed in two numbers. Systolic pressure, the higher number, which represents the pressure when the heart beats and pumps blood, and diastolic pressure, the lower number, which is the pressure when the heart is at rest between beats. Keeping blood pressure within a healthy range is crucial to ensure that the heart and blood vessels function efficiently and without undue stress, which is essential for overall cardiovascular health and the prevention of heart disease. When blood pressure is not controlled and remains high for a prolonged period, it can lead to several serious health consequences. Hypertension or high blood pressure significantly increases the risk of developing conditions such as heart attacks, strokes, heart failure, and even chronic kidney disease. Moreover, elevated blood pressure can cause damage to the blood vessels, leading to atherosclerosis, which is the hardening and narrowing of the arteries. This scenario further impedes blood flow and can result in even more serious complications, highlighting the importance of proactively monitoring and managing blood pressure. Cardiologists recommend diet control to maintain balanced blood pressure. Our Blood Pressure Under Control ebook reveals 15 fruits that can influence your cardiovascular health. Click the link in the comments to access the expert's guidance and keep your blood pressure under control. Various components found in fruits play a fundamental role in regulating blood pressure, including potassium and sodium. Potassium is an essential mineral that helps balance the amount of sodium in the body, acting as a natural vasodilator. This means it helps relax the walls of blood vessels, which can lower blood pressure. Fruits rich in potassium, such as bananas, oranges, and avocados, are often recommended as part of a healthy diet for blood pressure. However, it is crucial to maintain an appropriate balance, as excessive potassium can be harmful, especially for people with kidney conditions. On the other hand, sodium, which is found in smaller amounts in fruits but present in many processed foods, has the opposite effect. When consumed in excess, sodium can cause fluid retention in the body, which increases blood volume and consequently the pressure in the arteries. Although fruits generally contain little sodium, some, like melons and pineapples, may have higher levels that can impact people sensitive to sodium. Understanding these components is essential for individuals monitoring their blood pressure, allowing them to choose fruits that help maintain healthy blood pressure levels. Although most fruits are known for their low sodium content, some exceptions contain moderate amounts that can be significant for people who need to monitor their sodium intake for health reasons. For example, dried fruits like dried apricots and prunes tend to have higher sodium content due to the dehydration process that concentrates not only sugars, but also minerals, including sodium. Additionally, some canned or processed fruits may have added sodium during the preservation process. It is important to read the labels of these products carefully, especially if they are consumed regularly by people with conditions like high blood pressure. Sodium plays a crucial role in controlling the volume of fluids in the body, including blood volume. When there is an excess of sodium, the body retains more fluid, which increases blood volume and consequently the pressure exerted against the walls of the arteries. For people with hypertension or at risk of developing it, consuming fruits with high sodium content can contribute to further elevating blood pressure. Therefore, choosing fruits with low sodium content is recommended as part of a balanced diet to help control blood pressure and reduce the risk of cardiovascular complications associated with hypertension. Potassium is an essential mineral that plays a crucial role in regulating blood pressure, primarily through its effect on dilating blood vessels and balancing sodium in the body. This mineral helps reduce the effects of sodium by facilitating the excretion of this electrolyte by the kidneys, thus decreasing the fluid retention that elevates blood pressure. Moreover, potassium aids in the proper functioning of muscles and nerves, including the heart muscle, and in regulating heartbeats. Including an adequate amount of potassium in the diet is vital to maintain healthy blood pressure levels, which can prevent a range of cardiovascular diseases. Fruits are an excellent natural source of potassium, and some stand out particularly for their high content of this mineral. Bananas are often recognized as one of the main sources of potassium, but other fruits, such as oranges, kiwis, and melons, also offer significant amounts. For example, papaya and avocado are other potassium-rich options that can be easily incorporated into the daily diet. Consuming a variety of these fruits can help ensure adequate potassium intake, contributing to blood pressure control and overall cardiovascular health. However, it is important to consider potassium consumption within a balanced dietary context. For individuals with kidney problems or conditions affecting potassium metabolism, excessive intake can be harmful. In these cases, it is essential to consult a healthcare professional to adjust potassium intake according to individual needs. For most people, increasing the intake of potassium-rich fruits is a safe and effective strategy to maintain controlled blood pressure and promote healthy cardiovascular function. While fruits are essential components of a healthy diet, some may require moderate consumption by people sensitive to blood pressure due to their natural contents of sugars, sodium, and other compounds. For example, fruits like melon and watermelon, despite being nutrient-rich, have high fructose content, which in excess can contribute to increased blood pressure. Dried fruits should also be consumed cautiously, as the dehydration process concentrates both sugar and sodium, making them potentially harmful if consumed in large quantities. It is advisable for people with conditions related to blood pressure or at risk of developing hypertension to monitor the frequency and amount of consumption of these fruits. Moderation is key, and integrating a variety of fruits can help maintain nutritional balance without exceeding the recommended limits of sugar and sodium. Alternating fruits with high fructose content with those rich in fiber and low in natural sugars like berries and apples can be an effective strategy to maintain cardiovascular health without giving up the pleasure of eating fruits. Additionally, consulting a nutritionist or other healthcare professional for personalized guidance can be extremely helpful. These specialists can offer advice on how to incorporate fruits into the diet in a way that supports health goals without compromising blood pressure control. They can also help create a meal plan that considers individual health conditions, dietary preferences, and nutritional needs, ensuring that all food choices contribute positively to overall well-being and cardiovascular health. Several scientific studies have investigated the relationship between fruit consumption and blood pressure, providing valuable insights into how certain fruits can affect cardiovascular health. For example, research published in the Journal of Hypertension showed that regular consumption of potassium-rich fruits like bananas and oranges is associated with reduced blood pressure in individuals with hypertension. Another study by the American Heart Association highlighted that diets rich in fruits and vegetables, particularly those including kiwis and grapes, significantly contribute to lowering both systolic and diastolic blood pressure, suggesting that regular inclusion of these foods can be an effective strategy for controlling hypertension. Moreover, research has also examined the negative impact of some fruits on blood pressure control. A study by the European Society of Cardiology observed that excessive consumption of dried fruits, which contain high levels of fructose and sodium, can lead to an increase in blood pressure in sensitive individuals. This effect is attributed to the high concentration of sugars and sodium, which can exacerbate hypertension conditions if not consumed in moderation. These studies emphasize the importance of choosing and dosing fruit consumption based on their nutritional properties and individual health status, highlighting the complexity of diet and its influence on blood pressure and cardiovascular health. Are you taking good care of your blood pressure? Don't delay. Our exclusive Blood Pressure Under Control: 15 Fruits That Influence Your Health ebook is available for a limited time. Access the link in the comments and guarantee your copy before it ends. To maintain blood pressure at healthy levels, it is important to make smart food choices, favoring fruits and foods that promote cardiovascular health. Potassium-rich fruits such as bananas, avocados, and apricots are excellent for helping regulate blood pressure due to their potential to balance sodium levels in the body and relax blood vessels. Additionally, fruits rich in antioxidants such as berries, strawberries, blueberries, raspberries, and apples can help reduce inflammation and improve heart health due to their high concentration of beneficial compounds. In addition to fruits, including a variety of leafy green vegetables such as spinach, kale, and Swiss chard is also crucial. These vegetables are not only rich in potassium, but also in magnesium and fiber, which are known for their positive effects on blood pressure and cardiovascular health. Legumes such as lentils, beans, and chickpeas are also recommended, as they are rich in fiber and protein, offering a nutritious alternative that contributes to satiety without adding excess sodium. The key to a balanced diet that supports cardiovascular health and blood pressure control is diversity. Incorporating a wide range of fruits and vegetables, along with whole grains and lean protein sources, such as omega-3 rich fish, salmon, tuna, can help maintain a healthy cardiovascular system. Additionally, it is important to limit the intake of highly processed and sodium-rich foods, which can counteract efforts to maintain healthy blood pressure. Adopting these dietary habits, along with an active lifestyle, can result in a substantial improvement in overall cardiovascular health. Cardiovascular health experts, including doctors and nutritionists, often emphasize the importance of a balanced diet rich in fruits and vegetables for maintaining healthy blood pressure. They recommend incorporating a variety of fruits into the daily diet, especially those rich in potassium and low in sodium, such as bananas, avocados, and citrus fruits. These foods help balance electrolyte levels in the body and can reduce the risk of hypertension. Additionally, experts suggest moderate consumption of dried and processed fruits, which may contain higher levels of added sodium and sugars, and highlight the importance of checking labels for healthier choices. Another common advice is to diversify nutrient sources. Besides fruits, including vegetables, whole grains, and lean protein sources can provide a more complete nutritional profile that supports cardiovascular health. Experts also recommend limiting the intake of ultra-processed and sodium-rich foods, known to contribute to increased blood pressure. Integrating healthy habits, such as a balanced diet and regular exercise, is seen as essential for preventing and managing hypertension. Finally, experts advise individuals with pre-existing health conditions, especially those with a history of hypertension, to consult healthcare professionals before making significant dietary changes. This is important because, although fruits are generally beneficial, some may interact with medications or exacerbate specific health conditions. For example, fruits high in vitamin K, such as kiwi and avocado, can interfere with anticoagulants. Therefore, a personalized and supervised approach by a professional is crucial to ensure that the diet aligns with individual health needs and positively contributes to blood pressure control and overall cardiovascular health. Throughout this video, we discussed how consuming certain fruits can influence blood pressure, highlighting both those that offer benefits due to their high potassium and antioxidant content, and those that should be consumed with caution due to higher sodium or fructose levels. We emphasized the importance of understanding the nutritional components of fruits and how they can affect cardiovascular health, noting that while most fruits contribute positively to the diet, some require moderation, especially in individuals with hypertension or other related health conditions. We encourage viewers not only to incorporate a variety of fruits into their diets, but also to consult healthcare professionals for personalized guidance. A balanced diet, rich in fruits and vegetables, is crucial for maintaining cardiovascular health, but individual needs can vary. Healthcare professionals, such as nutritionists and doctors, can offer specific advice that takes into account pre-existing health conditions, dietary habits, and other risk factors. Thus, an informed and personalized approach is the best strategy to utilize the benefits of fruits in regulating blood pressure and promoting overall heart health. Were you surprised by some of the fruits that can raise your blood pressure? Remember, the key is balance and information. Which of these fruits do you regularly consume and will now start monitoring more closely? Comment below. I want to know your opinion. And don't forget, for personalized tips and more details about your health, consulting a professional is always the safest route. Stay tuned to the channel for more amazing tips like these, and see you in the next video.